Hello everyone, my name is Luke Piper, and I had the opportunity to shadow a P4 student named Faith Marie and her preceptor Thao at Northwest Medical Center. Thao is an inpatient clinical pharmacist who specializes in antimicrobial stewardship, which basically means she focuses on antibiotic use and optimizing those for the hospitalized patients that are at the hospital. In this setting, it basically means that she uses the antimicrobial medications, just like the antibiotics, antifungals, antivirals, making sure they're being used correctly and effectively for the patients. I guess her goal is to improve patient outcomes, reduce the risk of side effects and allergies, and prevent antibiotic resistance from developing, which is a pretty interesting topic. A normal day for Thao starts with reviewing reports of the patients, patients that could have came in or left even overnight, and the ones who are antibiotics she focuses on. She looks at what drugs they're on, looks for a lot of drug-drug interactions, how long they've been taking them, and if there's any reason to adjust their dosage, or if there's any new lab results or results that come in, what to adjust, and she makes sense on how to do that. So basically she reviews patient charts, intervenes if there is any changes that needs to be made with the medications, and she works with doctors who have prescribed the medications to change them or take them out. That's pretty much a lot of what she does. To work in this kind of position, pharmacists usually, they do 2 years of residence training nowadays. I know the preceptor Thao said that she only did 1 year, but she did it in like infectious disease and antimicrobial stewardship. But she worked, she did her P1 pretty closely to what she does now, so she was pretty confident in what she was doing and just wanted to get straight into it after. So she didn't do a P2, but she says nowadays that the PGY1 and PGY2 are more recommended and in infectious disease. So the P4 I shadowed was Faith Marie, and she had a pretty structured day. I think she said her hours were from 7:30 to 4, Monday through Friday. She also reviews the same lab reports that Thao gives to her at the beginning of the day, and she kind of goes through it all, checks all the medications, kind of looks at the SOAP note part of it, and looks for allergies and just kind of the vital signs. And she would give a SOAP note to her preceptor on what this patient, on pretty much everything about the patient and what she would do. And I'm pretty sure Thao would give her cases that she knows that Faith would be able to come up with a solution for, and how she's worked with her before. I shadowed on like one of the last few days, so Faith had a lot of confidence under her and had been doing some of these cases for a while, so she was pretty confident in what she was doing, which was pretty cool for me because I was able to learn a lot and just see how P4 would do these things in their appies. When I was talking to Faith, she said she would definitely consider working in this area after graduation because she enjoys being able to change things and help patient outcomes that directly impacts the patient's care, and hopefully helps them out. And she also liked having the schedule where it was just 7:30 to 4, and you come and go. You don't have to do any maybe extra hours every once in a while, but nothing out of the ordinary. When I asked for her advice on how to succeed in rotations, she said to be observant with everything that you see, and just ask good questions, come prepared for your appy, and just always ask questions, and just so the preceptor knows that you're engaged and willing to help out. I really enjoyed this experience, and I think I would also do an appy rotation here, because even from the few hours I was there, I learned so much, and it was very cool to see how inpatient pharmacists, clinical pharmacists work in the hospital, and how they can work on the fly and make adjustments and just see things and know what to do whenever they see them. I liked the stability of the hours and just showing up and being able to be comfortable and working with the team. And overall, it was an awesome experience, and it gave me definitely a new appreciation for how pharmacists work in the hospital. And I would definitely recommend checking it out, and I will definitely try it myself in the future. Thank you.